Almost exactly 1 year ago today, I heard from one of my counties in my district that they had just received notice from the VA that they were no longer eligible for the VA Highly Rural Transportation Grant Program. The county had been operating a van for the purposes of transporting veterans to the Department of Veterans Affairs facilities to receive medical care, free of charge since 2014. Over the years, this service has proven essential to veterans seeking essential care to things like chemotherapy and critical surgeries, treatment for heart conditions. In 2022 alone, the van made approximately 300 trips and transported between 40 and 60 veterans. However, due to the definition of eligibility for these grants as set in statute, as fewer than 7 residents per square mile, Skamania County learned that due to new census data and migration changes that happened during the pandemic, that our rural county was no longer considered rural enough. Now we are at 7.15 residents per square mile, and with just 1 week's notice, we lost transportation funding. So I sent a letter to the Secretary of Veterans Affairs, McDonough, in October, urging the VA to fill transportation gaps for rural veterans and work with Congress to redefine highly rural. In a reply earlier this year, the department expressed support for the provision outlined in Rural Transportation to Care Act. The bipartisan bill would improve how VA measures rurality, helping more veterans living in rural areas get transportation to VA or VA-authorized healthcare facilities. The bill would also expand eligibility to both rural and highly rural counties, as well as tribal organizations. Lastly, the legislation would increase the maximum funding amount so transportation services could keep pace with inflation. It is our responsibility to our nation's heroes, ensure that our nation's heroes are well supported after returning from home and can access the benefits they have earned and deserve. Just last week, I was visiting with veterans in Pacific County about how vital these kinds of transportation services are, and they're literally life or death. People who have been waiting for appointments for 18 months can lose an appointment if they're just 10 minutes late or 15 minutes late to their appointment, setting them back 10 months to care. Access to professional, reliable transportation is critical to deliver life-saving care to our veterans. As veterans across my district and the country face dramatic reductions in life-saving services, it is our duty to make sure they are not left behind. This bipartisan bill won't only restore critical healthcare transportation services for Skamania County veterans, but will also newly expand eligibility to make sure more veterans in rural areas around the country have a safe and reliable way to get to their appointments and receive the care they deserve. I thank you again for the opportunity to testify on this bill, and I look forward to continuing to work on getting this across the finish line.